If you notice one leg swelling more than the other, especially after age 50, you have a critical 72-hour window to rule out a dangerous condition. This is not harmless water weight. It is a sign of obstruction. According to vascular specialists in Tokyo, one-sided swelling is the most frequent, quiet warning sign for a deep vein thrombosis, or DVT. DVT is a blood clot that forms deep within your leg veins. If that clot breaks free, it travels instantly to the lungs. This results in a pulmonary embolism, or PE, a blockage that can be fatal within minutes. Most people ignore the earliest symptom. They mistakenly believe DVT must be intensely painful. But current medical data confirms up to 50% of DVT cases cause minimal pain or no pain at all. We will show you the simple, clinically backed 3F test to check this at home right now. Watch closely, because later we review the 5 common mistakes that can actually dislodge a clot and send it to your lungs. DVT is a blood clot. The clot acts like a dam deep inside the vein. When a vein is blocked, fluid cannot return to the heart. It backs up, causing sudden, firm, single-sided swelling. Why does this risk rise sharply after age 50? This is due to 3 factors: slowed blood flow, hormonal changes, and dehydration. As we age, blood flow velocity naturally decreases, and many adults lose muscle mass. The calf muscle is often called the second heart because it actively pumps blood up the legs. When that muscle action slows, blood is more likely to stagnate, a critical risk factor known as venous stasis. Stagnant blood thickens, making clot formation significantly easier. Consider the case of Mr. Sato, 67, a retired teacher from Kyoto. Mr. Sato thought his left leg felt heavy and warm from standing too long in his garden. Crucially, he felt no severe pain. He decided to elevate the leg and sleep it off. This decision was almost fatal. The next morning, the swelling had worsened, and he suddenly felt a shortness of breath, a major sign the clot may have traveled. At the hospital, a non-invasive duplex ultrasound confirmed a large DVT. He was immediately put on blood thinners. He was lucky; the clot had not fully blocked his lungs. His words later were recorded by his physician. "The only symptom I paid attention to was pain, and that almost killed me." The rule is simple: compare both legs. If one leg feels heavier, firmer, warmer, or appears reddish-blue compared to the other, it is a serious clinical red flag. To empower patients to recognize this risk, Japanese vascular clinics often teach a simple 3-part self-assessment. We call this the 3F test. Step 1. Feel. Run your hands gently along both legs. Does one leg feel significantly firmer or hotter to the touch? Inflammation from a deep clot often generates heat. Step 2. Flex. While sitting, point and sharply flex your foot toward your head. If this movement causes a sudden, deep, persistent cramp or pain in the calf muscle, it is a warning sign. Step 3. Foot color. Sit for 10 seconds and compare both feet. A sudden onset of dusky, reddish-purple, or pale color on one side suggests significant impairment of blood flow. If you note 2 or more of these 3F signs, you must seek emergency medical evaluation immediately. This condition is non-negotiable. Specialists have identified 5 common self-treatment mistakes that can critically delay diagnosis or worsen the DVT. Mistake 1. Ignoring lack of pain. Up to half of DVTs are clinically silent. Never wait for pain to take swelling seriously. Mistake 2. Rubbing or massaging the swollen area. Do not do this. Pressure or manipulation can physically dislodge the clot from the vein wall, creating the fatal pulmonary embolism. Mistake 3. Applying heat or taking a hot bath. Heat causes vasodilation. This increased blood flow can destabilize a clot and promote detachment. Use cool compression only if advised by a doctor. Mistake 4. Thinking it's just water retention. Ordinary fluid retention typically affects both legs equally, often associated with kidney or heart issues. One-sided swelling is the crucial differentiator. Mistake 5. Flying or sitting immobile for long periods. Immobility is a primary trigger. If you suspect DVT, do not travel or remain sedentary before a medical professional rules out a clot. Men and women over 50 are already in a higher risk category. However, certain conditions multiply the danger. Recent surgery or hospitalization. Long-distance travel. Active cancer or chemotherapy. Hormone therapy. Smoking or severe dehydration. Family history. If any of these factors apply and you observe one-sided swelling, you must treat it as a medical emergency, not a coincidence. Japanese hospitals emphasize low-impact, continuous movement for blood flow, a concept specialists call natural anticoagulation. 1. Aggressive hydration. Aim for at least 1.5 to 2 liters of water daily. Dehydration is the fastest way to thicken blood. 2. The 30-minute movement rule. Never sit for more than 30 consecutive minutes. If you are seated, practice ankle circles and toe pumps every 30 minutes. 3. Morning bed flexes. Before getting out of bed, perform 10 cycles of pointing your toes up and down. This primes the calf pump. 4. Post-meal walking. Even a short 5-minute walk after lunch or dinner engages the calf muscles and significantly improves venous return. DVT often starts as a whisper, the single-sided swelling. Don't wait for the scream, the chest pain and shortness of breath of the pulmonary embolism. If one leg swells, feels warm, or feels tight, do the 3F test now. If you note 2 or more signs, call your doctor or proceed directly to urgent care. Early detection leads to successful treatment and prevents fatal complications. Listen early, live longer.